Good morning, everybody. Thank you for joining us this morning. Just to introduce the session for you. Really, we're going to be focusing on virtual interview services for local councils and sharing some experiences that we've had in other sectors. So, by way of introduction, my name is Paul Morgan, Account Director for Modality, responsible for local government sales in the UK. We have Tom Scott, our Product Manager for our software products, who will be doing the bulk of the presenting, and Darcy Golding, who works with me in inside sales. So just before we get into the main part of the presentation, just a slide or two to introduce Modality for those of you who aren't familiar to us. We've got it now. Well, in fact, it's 13 years now with Microsoft, our track record, and we focus really as a unified communications partner, and really specialize in complex voice environments, which is quite topical really as the market is now migrating away really from legacy PBX systems and from Skype towards Microsoft Teams. And we've certainly seen a lot of activity during the COVID period. We are a global organization, and we've got a very strong team of consultants, project managers, and focus on designing, delivering, and supporting unified comms solutions, predominantly, in fact, exclusively with the Microsoft stack and the associated ecosystem partners they have that make the solutions work, things like contact center and call recording, etc. We are fast track ready, so we can assist you in securing funding for initiatives from Microsoft. And we do also have an in-house development team, and one of the products, or the main product that we'll be talking about this morning, has come from that team that we've designed and developed in-house. And certainly, our experiences on Teams have been quite varied, and we've been a partner with Microsoft on the technology adoption program for the last 3 years since the application first came to market. And therein really has been the strength of our product developers in terms of bringing out solutions really that complement the core offering of Teams. So just like to give you a flavor of the sort of customers that we've dealt with and continue to deal with. So we advance to the next slide, please. Okay, this is by no means an exhaustive list, but it's just to give you a feel for, not just in local gov, but in other areas of public sector, such as health and emergency services and central government. Again, we have a very strong user base of loyal customers, and many referenceable customers amongst that list. So with that, I'd like to hand over to Tom Scott to really introduce you to the one consultation application.
Lovely. Thanks, Paul. Good morning, everybody. Thank you very much for your time this morning. As Paul said, the main part of the presentation today is going to be around our one consultation service. And I just want to talk to you at a very high level, an introduction to some of the challenges that we've seen. We've seen companies across all public sectors and a lot of private sectors and all verticals having similar concerns and similar challenges around providing services virtually, and then just talk about a bit how we're working with customers to address these with one consultation. An example and a case study of how both Humberside Police and Berkshire NHS are using one consultation, and then also what we're doing next with the service and where we're looking to take that. So as at a high level introduction, one consultation is a virtual consultation service. So it's designed for any type of engagement, any type of meeting between someone who has Microsoft Teams or Skype for Business and has what we in IT describe as a corporate or an enterprise account, where basically you have your company email address and you have Teams, and you want to do a virtual consultation with someone who is a member of the public outside of your organization who doesn't have that Microsoft account. So how do you basically continue to deliver these services, and how do you reach people using video consultation and make that experience as easy as possible to join. So just by way of an introduction, some of the challenges and some of the things we've seen over the last 3 months have really changed the landscape for video conferencing exponentially, particularly around the way we socially interact with people. I've worked in video conferencing for years, and it's incredible that because of the lockdown and the social restrictions put on everybody, the idea of a Zoom meeting now, or a Teams meeting, or whatever platform it is, as a way of keeping in touch with people and a way of doing something other than a corporate IT meeting or a big board meeting has now become second place. It's perfectly acceptable, and everybody's very happy now to do a virtual quiz that you see people doing, or families catching up over video consultations. So it's changed the landscape completely in terms of people's acceptance of the technology. What we saw at the start, back in March, in the UK, when the restrictions were first put in place, was a lot of very quick and very agile work to get. It was specifically within the NHS. Oh, I do apologise. I beg your pardon. It's the joys of working from home. That was my landline that went off. So we're working very agile and very flexibly at Modality. And I was just desperately trying to turn it off. But so what we've seen, going back to my slides, as you can see, this is live and unedited. What we saw was this rush to how to keep delivering existing services from NHS trusts to patients virtually when the initial restrictions were imposed. So we did some work, and I'll talk about that with Midlands and with Berkshire NHS as to how to enable and equip them quickly to allow their services to continue to work virtually with their patients. And interestingly, what we've seen is that as restrictions have started to ease, when it all started, we were all under the impression that we'd see a huge spike in usage because everybody had to. But we thought anecdotally that some people would at least go back to normal, or as things started to ease, people would return to a traditional way of working and to do these consultations. And the feedback we've had is actually that now that the public patients have experienced this and they're comfortable with the technology, it's something that they very much want to continue doing. So it's something they want to, even now that they have the ability and that services have been delivered can offer some in-person services. People like the convenience of a virtual consultation service. And that the final bit of feedback we've had actually is comparing the numbers of services and actual consultations completed at this time of year compared to this time last year. Services within Midlands NHS Trust are delivering more consultations in the last 3 months than they did in the same 3 months last year. So it's actually increasing capacity of the service as well, and an uptake by people being able to do it virtually. So it's something we see that it's very much now an opportunity to capitalize on it, from the idea of introducing it to people to be able to offer that digital alternative, to capitalize on that change in mentality around how video consultations are perceived. So for our point of view, there's some key things that we do to be able to do that. It has to be an option that's quick and easy to use. You can't put adoption barriers and have something really complicated for people to use. Otherwise, they're going to struggle to do it. Need something. There can't be any plugins or any kind of accounts need to be created. It's got to be as quick and easy as registering for an appointment and going into the service or the surgery or the office that you would go into. It needs to be able to scale, obviously, and support large call volumes. And finally, one of our key challenges for us as a provider is the security element, and it needs to be secure, and so there's no public or personal information stored and transferred at all within that, either retained by us or visible to either participant. The final piece of this, very quickly before moving on, is it's a note at the bottom that I put in there of why not use Microsoft Teams for this. And it's very simple. It's the idea that in order to use Teams with someone outside of your organization, you have to send them and invite them to a meeting. And at that point, that member of the public has the email address of the clinician or the police officer or the social worker who's scheduling the meeting. So it's something that where it's a use case where you don't want that public person to have that information. This is the fit that one consultation has. It gives you a way to maintain the anonymity of the doctor, but still be able to do the in-person conferencing with the clinician or police officer, whoever the professional person is using Microsoft Teams. So again, building on this, the challenges set out for us when we built this were that it had to be easy to access with no logins, no apps, or no passwords required. We wanted to use existing platforms within the sector. So rather than a wholesale end-to-end solution, we want to fit in with what you do on the back of Office 365. We offer multiple waiting rooms for different services. So you can have as many waiting rooms for the services that you need. And the key thing for us is that there's no personally identifiable information stored, and everything is hosted in the UK or the EU in Microsoft Azure. And we run this as a service, so we're constantly updating it. We're reusing the latest technology, all of the latest security measures, so that everything's up to date, and we manage that whole thing end to end for you. So one consultation, just in summary, it's an Azure-based portal and service that is hosted by Modality. It's highly scalable and secure, and by scalable at the moment, I think we've got 30 conferencing servers and conferencing nodes in 2 different locations, so that we're confident in the scale that we can deliver and the resiliency that provides. And we also, I'll come on to talk to the security model in a moment, because that's very prevalent in this world. If you've seen the news over the last few months, and this has been something that a lot of people have spoken about with virtual consultations. It's a simple and it's fully customizable, the join experience for people, and it piggybacks off your Skype for Business and Teams environment. So if you've got that deployed, people are using that already, this is just another application of that technology that already exists with it. So I'll just go into a quick demo as to how it works, and then show you an example of both the patient and the clinician, or the professional Office 365 user screens that you see with one consultation. So the workflow is that the user, or the public user, would enter the lobby of the service that they're joining. The police officer in this case is then notified, or the social worker or the clinician, whatever the use case is. They are then notified that the person is there. There's an optional audio video test available for the user, just to make sure that all of their webcam and their speakers are enabled before they join. And then once all that's happened, and the user is waiting in the consultation room, then the police officer would join using Microsoft Teams at this rate. So their discussion is then confidential, and then it's wrapped up, at which point the user is directed to a questionnaire with some follow-up survey questions, just to give some feedback on their experience with consultations that you'll be able to see, and that we use to help shape the service. So very quickly, I'd just like to go into a demo and just show you quickly the two examples of the patient portal and then the clinician portal. So this is an example of what you would send out to a patient or a member of the public joining the session. So at the time of their appointment, they would go to demo.oneconsultation.net or whatever you want that to be called. They just enter their name and they click on them. Once they've done those two bits, they can then click on begin consultation, and that then takes them into the call. And once they're at this point, that's everything from their side. Everything is hosted through their web browser. There's no need for any plugin or any kind of application to be downloaded. Once you see this screen, you are then in the consultation, ready to speak to your doctor or police officer, whoever the use case is. From the clinician side, they would go to admin.oneconsultation.net, and this is, we call this the virtual waiting room for one consultation. So they can sign in using their Office 365 account. And then this is the virtual waiting room that you would see as the clinician. So each of these tiles is a virtual consultation with a patient in it. And then when the clinician would like to join, they just click on enter room. That will open Microsoft Teams, and then they can place a call directly into the consultation using Microsoft Teams. That will open Teams. And then you get prompted with a conversation, with a chat within that you just click on call, and that takes you into the call to go in. We can control access as well, so that clinicians and can see multiple waiting rooms. So if you just go to the change room option, then you can see all of the rooms that you have access to. So as an example, for Midlands NHS Trust, we deployed 180 different virtual waiting rooms over a weekend for them, so that it aligned to each of their services. And just to follow on from that, talking about Midlands NHS Trust, we engaged with Midlands and they had a trial of one consultation ahead of the COVID restrictions, but it was massively increased when the restrictions hit. So we implemented 180 different services and different virtual consultation rooms following that trial period over the course of a weekend. And they have, well, this slide is a bit out of date. They've delivered nearly 7,000 consultations since then, using one consultation. So the other thing that we've done with them is that we deployed a real-time reporting dashboard, so that we give them a Power BI report and dashboard that gives real-time visibility of the quality of the calls and the usage as well, so they can see those in real time. And that has empowered them then to move to Microsoft Teams to use one consultation. So they've moved from Skype for Business to Microsoft Teams as part of this move as well. And that's not just for one consultation, that's so they can adopt Teams across the organization. So I guess to summarize from our side, what we've seen is that throughout all of the COVID restrictions and all the ITeams that we've worked with, it's really been an amazing response from everybody in this world to respond under the pressure to enable people to work remotely. It's virtual consultations is one element of it, but it's also been the ability of all the teams we've worked with to to empower people to just continue to work remotely using Teams or Skype for Business. And then to layer this up on top of that is just adding another string to those bows that that we see as being really valuable to different organizations. And I think what it's fair to say what we've seen is over the last 3 months that providing a digital option for services is going to be crucial as we go forward. That it's been forced upon us, and I think in circumstances that nobody would ever wish for. But one of the things that has come out of it is that you have people experiencing and now for a comfort level with virtual consultations and video technology that wasn't there before. So this is going to be something that's crucial and is going to be expected of services going forward. And finally, the last point from me, just before wrapping up for any questions, is that if you're using Microsoft 365 and Teams, and that is your ecosystem, that's the world that you're looking to go down, One Consultation has been to fit every element of that. It uses Teams, it's hosted in Azure, and all of our reporting elements are through Power BI. So we are, as Paul said at the start, we're a Microsoft partner. We work very closely with Microsoft, and we've built this service to fit into that existing and utilize that existing backbone and scale. There is a trial. We can offer you a free trial of One Consultation. You can register this through the below website or reach out to Paul and myself directly. But we can offer you a month trial of One Consultation to evaluate it, to use it in your services, in your live services, and see if it's a fit from there. So if you'd like some more information on that, then there's a link there to the website. I believe this recording and this slide deck will be sent out. But if you're interested or would like to know more about that trial, then please feel free to reach out to us. We'd love to have that conversation and talk to you about where One Consultation could help.
Yeah, just to interject there, Tom, if I may. I mean, obviously we've talked about use cases that we have actively in NHS trusts and police forces, but we're actively looking for a reference customer in the local government sector. You know, we know that there must be very good use cases for One Consultation, you know, be it in social services or other areas of the council. And yeah, we'd be happy to work closely with an organisation that would like to partner with us in this regard. So we can provide the trial, as Tom said. We can provide sort of favourable commercial terms, really, just so that we can establish that anchor client, so to speak, in the local and regional government sector. So I think are we opening up the floor now, Tom, for a few questions, if there's been anything come through?
Yeah, no, there was. I'm just looking to see if there's been any questions come through in the chat, and I haven't seen any there. So I'll just give it a second to see if anyone was holding on till the end to see if anything comes through.
But I mean, the other thing is, we'd be more than happy to arrange an individual session whereby we can discuss your application in a bit more detail, go through a sort of a more detailed demo for you, so that you can see exactly how the application could play a part in your organisation.
Absolutely. I haven't seen any questions come through, so just check. No, I've not seen any questions come through. So I will call it there. If anything, you'll got our details now from this. So if there's anything that does spring to mind, please feel free to reach out and contact us. But I would just say thanks from everyone here. Thank you so much for your time this morning, for joining and listening, and have a great rest of the day.